Thank you so much for joining us for Demystifying Money. I'm joined by Michelle Doran. She is the co-founder and clinical director of RN Aesthetics in the North Shore. She has the distinction of being a national trainer for allergen, am I saying that right? Medical aesthetics for both the Accelerate and Elevate programs. She serves as a clinical faculty trainer for the Academy of Injection Anatomy, a cadaver course focused on anatomy and safe injection techniques. Okay, so you are definitely the person to talk to about the beauty business. Thank you so much for coming on the show. Tell me a little bit more about RN Aesthetics and kind of how you decided to maybe, I'm not sure if you left nursing to start this or if this was always your plan, but how did you become the co-founder of this business?
Well, first, thank you so much for having me. We founded RN Aesthetics in 2012, myself and a registered nurse. We both had extensive nursing experience from the hospitals. She was a school nurse. I was a nurse practitioner doing primary care and palliative care. And we wanted to get into something that was a little different in terms of medicine and really fun, where you didn't have to deal with insurance, where people were actually happy to be there. And it was more toward the health part of what we do rather than always taking care of people when they're sick and not feeling well. And so that's when we really decided to venture into aesthetics. This was pretty early on. Now aesthetics is a huge field, but when we started, we were one of the first nurse-owned med spas in the country, really, and definitely in Massachusetts. There's a handful of us that really kind of led the way for nurses to become more of entrepreneurs, get out of the hospital setting, and do things a little more geared toward health and wellness and aesthetics. So that's how we got started.
Yeah, so in 2012, it was different. I was looking, there was a study, Boston Consulting Group did a study in 2023. It said revenue from US medical aesthetics totaled $9 billion in
Yes.
2022, and the growth was up 10% each year since 20. I mean, it is a massive industry. And there's a lot of, what do you think? Because, I like to look at things from the business perspective, from, the investment side. That is a tremendous amount of growth and a lot of money. What do you think is maybe, has it always been something that people have wanted, or is it access, or what do you think is causing a lot of this shift in this business?
I think a huge part of it is the social media influence. We didn't used to be on camera ready for everything,
Mhm.
even with what they call the Zoom boom. So during COVID, when everyone had to be working from home but camera ready, I
Mhm.
know a lot of plastic surgeons and aesthetic practices saw a huge boom in procedures.
Mhm.
One thing that I realized is during COVID, when we're kind of stuck at home, people were really doing this for themselves. I think it's part of just self-care, investing in your own self, feeling more confident. And it's not all about vanity. That's sometimes what you hear people say, but we see women in particular come into our practice who maybe are going through a divorce or they've lost a parent or they're a caregiver. And this is a way to really take care of themselves, feel more confident, um, and just get their face out there and feel better.
Yeah. And I think, that definitely is true. A lot of us, when I was working in Boston and I was in meetings, I was not staring at myself.
Right.
I wasn't, like it is a really interesting um thing that's happened as far as being on camera, being on video, where even before a lot of people would just keep their camera off if they ever had to do a meeting. And now that's almost like, I wouldn't say it's unacceptable, but it's just really not like, I don't think I could really do business that way with people. And so I think it is, and then the social media, of course, we are seeing a lot of pictures, a lot of beauty, a lot of filters, a lot of things that might be real, might not be real, but it is definitely front and center, I
Yes.
think, as far as people are thinking. And and you mentioned the thing about the vanity part, which I think is funny. And I will say this, I work with a lot of people and I work with a lot of people on how they spend their money. And a lot of times with women, they will have to justify for some reason, not because I asked, any of the money they spend on themselves
Right.
versus the money they spend on their kids, their family, their friends. And I don't know necessarily if that just comes from this like ingrained shame or guilt or some feeling. Um, I personally don't think that it matters if you want to look better. I'm fine with it. I mean, people fix their teeth without shame. People try to lose weight and join gyms. They do all of these things.
Right.
And wanting to look better, I don't think is that big of a crime as far as, but it is interesting how that maybe is changing. Aging is different. I saw something the other day that said like the cast of Friends now is older than the oldest Golden Girl or the Golden
Right.
Girls.
Yeah.
And I remember in the 80s, like that's what a 50-year-old woman looked like.
Totally.
So it was this massive shift. So has it been like a combination of, science and like what's changing as far as, maybe it's like where us Gen X people, like, did we just burn off enough of our face with like St. Ives scrubs and like sea breeze or whatever that now we're just going to be, you know, we're just going to look young forever. But tell me a little bit about the technology and the science behind it, because I
Yeah.
think it is really fascinating because aging, no matter how you look at it, it's different.
hmm so our practice is really focused on healthy skin as the
Mhm.
foundation. Preventative treatments, using sunscreen, using retinol products, antioxidants, lots of education with our clients on what they should be doing. But we also use a ton of lasers to reverse old sun damage, to treat skin conditions like acne and rosacea. And of course, injectables, Botox, dermal fillers. But the technology has really improved. I mean, even in the 12 years that I've been in the industry, the lasers are amazing, minimal downtime. So, I think that's part of why more people are doing it, because there's really very little to no downtime, or what we call social downtime. And so you could go in for a laser procedure and you're not at home for 2 weeks having to take time off of work and not being able to go out and about. You can just go about your business. I also think, as you mentioned, people are more open and honest about it. Friends share, yeah,
Mhm.
just like getting your hair done or getting your nails done. This is part of self-care. And when someone looks great and their friends say, geez, you look amazing, and they don't gatekeep and they say, yeah, I had some Botox, I had a hydrofacial, I did a laser treatment. It takes that stigma away, and it also takes away that fear that what they're doing in terms of having aesthetic treatments, they still look really natural. They don't look weird because
Right. And I think that's something that before you mentioned the downtime, like somebody would get a facelift and
right.
look different 2 weeks. And it was just like that was cosmetic surgery. Like that was kind of the impression. And I think that that's scary for a lot of people to feel like I'm going to look, like different or strange or clearly somebody who's had work done. So I think that's interesting that you say when people are like, "Oh, you look amazing." They're just like, "Yeah, this is what I did," instead of just being like, "Yes, I used olive oil on my face," or "I got a
Right.
good night's sleep." Like, come on.
Right. And
Like,
that's, the celebrities that do that, that create skincare lines
yeah.
and say, and don't admit to doing things. It's it's really not fair
Mhm.
to women who are looking to them for, why are you 50 and you look amazing?
Mhm.
Oh, exactly that. I use olive oil on my
Mhm.
face. They're doing other
Yeah.
things, you know.
Yeah. So from your perspective, is this more something that, women are, is there space in this industry? Are men starting to get involved in this space? And what are the treatments that you're seeing that a lot of the men are either having a lot of success with or that are really, going to be maybe something in the future that might continue to grow?
Yes, we are definitely seeing more of a shift toward men coming into the aesthetic arena. Um, it used to be like 95% women, 5% men. I think recent statistics shifted about 85% women, 15% men. And we definitely are seeing more and more men coming into our practice. Um, a lot of men invest in skincare, hydrofacials.
Mhm.
They love that because it's a quick treatment, their skin feels clean, we have, in my practice, we have these two brothers that are construction guys. They're these big burly guys, and they come in for hydrofacials together. And their skin looks so much better because they're outside, the dirt,
Right.
the environmental
Mhm.
exposure, all of that. Lasers for men, we're seeing more and more laser treatments, Botox instead of Botox, we call it Brotox. So guys are coming in for a little bit of Botox. Um, and then of course they're getting more into the wellness space,
Mhm.
IVs, weight loss, things like that, just health and wellness.
Yeah.
Sometimes I see women dragging their husbands in because the
Mhm.
women are looking so good. They're like, they always say, my husband needs to come in and have a treatment.
Yeah, no, I think
Or
that's
like aging
interesting.
backwards.
Yeah, right. Because I think, the men, they're on the camera too. They're seeing it. But I love the thought of even people, and because it's like the skin, it's like the largest. I mean, you're the scientist, but this is the largest organ in our body, right? Am I correct on that? Yeah. And I mean, having scarring, having damage, sun damage, a job where you're exposed to the elements, like that does, if there is a way to either correct that, reduce it, minimize it, I think it's just such a, the technology, the science is there. It doesn't just have to be for the ladies. you know,
Right.
I think in the
We're
long.
seeing more and more teenagers coming
Yeah.
into our practice. Part of it is that their moms are bringing them in. There's a huge wait to see a dermatologist these days. Kids
Yes.
that are struggling with acne, they
Mhm.
really want to use good skincare products and have different treatments. And so we're seeing kind of the whole gamut from
Mhm.
teens all the way. I have women in their 80s that come in for treatment. So
Yeah. I think it's interesting you mentioned the teens and the kids, because you're right. Seeing a dermatologist is something that I remember. I think it was close to a year wait to get to be a new patient. And I think for a lot of people who are seeing maybe they struggled with acne or, other skin conditions as a child, they're seeing that, my kids are 11 and 9, so not quite there yet, but, I think that if there is something that can help them. I remember when a family member used, like, Proact. I think that was the thing for the first time, and it's kind of it's such a game changer as far as your confidence and your just really everything in your life at that point. So, tell me, I am seeing, though, a lot of spending on skincare for younger children that
mm,
seems to me to be a little bit trendy, and
yes,
maybe like a TikTok influencer, not a nurse,
right.
not someone who's trained. So tell me, like, what are your thoughts in that space? And what is maybe worth it for someone that age to start if they need to have they want to have a skincare routine, or they want to, take good, even have good habits from the start? What do you think is the most important thing that they should be doing?
I agree. I was in Sephora the other day and it was a half day and it was just packed with teenagers looking at makeup and skincare and things like that. I have three teenagers myself. I have a 16-year-old daughter and I have 18-year-old twins. And I'll occasionally see a package arrive and it's from a TikTok influencer, and I'll read the ingredients to my daughter and I'm like, look at these ingredients. The first ingredient is mineral oil. It's going to make you break out, you know. So I think more medical professionals need to be the influencers to talk about simple and affordable regimens for teens that really work. The first and easiest thing is just wash your face. A lot of teens don't wash their face properly. We've all heard that 2 minutes brush your teeth,
Mhm.
but the same thing goes for just cleaning your face twice a day. And then we will just recommend, we carry a couple skincare lines in our practice. One is super popular with teens because it's a oil control pad that
Mhm.
they use. It's kind of reminds me of those old Stridex pads that we
Yeah, like the
have.
Oxy and the Stridex, yep.
And this has a little bit of like salicylic acid in it, but it's gentle and it just reduces that oil, which reduces inflammation in the skin and improves their acne. So cleanse, a nice oil control pad, and then we have them just use antioxidants something very simple, and a sunscreen being most important. And that's something my kids, I hassle them when the weather's nice, they're going to the beach. I'm like, you need sunscreen. You have to reapply. That is the number one way to really improve the way we age.
Mm. Yeah, no, and is there anything like you'd say, like if somebody maybe, maybe their kids want what they're seeing the influencers are promoting, but are there any inexpensive or any lower budget drugstore products that you think are just are just good or fine for somebody who maybe doesn't want to spend the kind of money they spend on themselves on a child?
And we get asked that question a lot from parents. We try to make like mini regimens that are affordable and that last because we know that they work. But, a nice gentle cleanser from the drugstore is fine. Something that maybe has a little bit of salicylic acid in it and foams. Um, Sunscreen, I prefer a mineral sunscreen rather than a chemical sunscreen. You can find things like that in the drugstore. And then just a nice lightweight serum that has some antioxidants. Um, that I think one of the problems is that we call it, we see this in our practice a lot. People purchase things because they're a little less expensive,
Mhm.
and then they just fill their medicine cabinet with products that just don't work for them. And so they keep replacing them with other products, and they end up spending a little more than they would have had they just, got a customized
Mhm.
regimen and told, like, we're very mindful of what someone's budget is.
Mhm.
We also have a lot of like travel products that are a little more affordable, but so it's just balancing what's going to work and your budget.
Yeah. No, I agree. I think that happens with a lot of things where certain things are worth the investment, and it's just kind of understanding that this is an area that we are going to spend in, and that other things maybe are not. And that's always going to be somebody's, perspective, whether they, want to make sure that, okay, we're just going to use this wisely and this is all we're going to have, or we're going to go every week and try something new, because that definitely adds up. And you're
Right.
right, it starts, I remember having quite a bit of clutter in my
Yeah.
closet. And I'm like, what is, I think it was more with makeup though. And instead of buying like what I knew was good, I would try a bunch of others, and then they would sit in the closet. And
Mhm.
so
I
I
noticed
think
that
that's
with my daughter too. My 18-year-old, I go into her room and she's got like a big thing of makeup. And a lot of it is like foundations or
Mhm.
cover-ups. And I'll say to her, so I got her, she comes in regularly for facials, she uses skincare products, and I got her a nice gentle tinted sunscreen. And I said, stop trying to cover up your skin.
Mhm.
Just use something with a little tint that's good for your skin. It's not going to make you break out, and really less makeup, healthier skin,
Yeah. Yeah, no, definitely, especially at that age. God.
Mhm.
I think about that, and yeah, no, I think that's really smart. But I think if you do have conditions, seeing somebody like you, especially if there's a wait at a dermatologist or something like that, that can be really, really helpful. And
Mhm.
so, when people decide they want to work with you, a lot of people might not really know what to expect. So what would the process be for somebody who, I think maybe if they're interested in learning what they need and they're a little afraid, I don't know if you've ever watched the show Nip Tuck, where she goes in and he just markers up her whole body and it's terrifying. What is the consultation process like for you? And then really like how does, what are some things that you really need to commit to? And what are some things that might be more of a like when you want to, go in, have a treatment maybe once a month or quarter or something like that, for something that helps you feel good and is good for your skin?
So our process, we have 5 nurse practitioners, and then we have 7 nurses on our team and 7 estheticians. So what we like to do when you first come in is set up a consult about 30 minutes with one of our providers. Depending on what you're looking for, what your goals are, we'll match you up with the best provider. We have this machine called a Visia skin analysis. So we'll pop your face in there, and it takes photos and it looks under the skin so we can see inflammation, redness, pore size,
Mm.
sun damage, all of those things. And then we try to create a treatment plan for you based on your goals and your budget. We are very mindful of people's budget. So we want to give you the best bang for your buck. So it might be something like starting with, you know, every other month, a hydrofacial.
Mhm.
It might be, depending if you have a lot of redness and sun damage, we might say, let's start with a series of laser treatments, 3 sessions, get you on some products to protect your investment at home. And then let's just do some maintenance treatments after that. So we'll create different plans for patients based on what their goals are. Some things we recommend doing regularly, coming in at least season changes for a nice hydrofacial, which really just deeply cleans the skin, or a chemical peel that will just turn that skin over. If you're going to start having Botox treatments, it's something that you do really want to commit to every 4 months. Otherwise you just kind of, you have a treatment, and then if you're not maintaining, then you're kind of always starting
Okay.
over.
Yeah.
Yeah.
That's definitely good to know. And yeah, I think it's interesting. I'm a big, even when people, they don't know what they need, they know they need help with their finances. Sometimes it's like, if you can't start with like, understanding exactly where you're at right now, and we can't measure it, then it's very hard to see like progress and success. So a lot of it is just kind of awareness and like looking at how things are. So I love that you have that, even the machine that kind of says, this is where we started.
Mhm.
And these are the goals, just to be able to measure certain things and show, you know, a plan.
Totally.
A plan. But I think that's a really interesting thing that maybe people, didn't know was out there, to kind of see like, okay, how am I doing? Like, what, is my skin, what can I do to help it? What can make things better? I think it's a really interesting way to go about it. And I think that's where your career, your training is helpful, because I do see sometimes too people being like, I've got extra Botox, $10, whatever. Like, how important is it to work with somebody who is a licensed practitioner in this space?
I'm muting myself because my dogs are
Yeah,
barking.
that's okay. I can't.
They're elderly. Working with licensed providers is really critical. Um, our team, we start with our nurse practitioners. They go over your medical history. We make sure that the treatments that we're recommending are really safe for you based on what your medical history is. Um, and everything we do is really based in science. We're always doing ongoing trainings, keeping up with the latest education. And that's really important to our practice. So you should feel comfortable when you go into an aesthetic practice, when you're having a consult, feel like, it's a relationship. You have to mesh with that person. How were you greeted? What was the process in terms of the consultation? Are they mindful of your budget? Are they listening to what your goals are? And you really want that comfortable relationship with the practice that you're going to invest your time and money in.
Yeah, I definitely think it's a scary area for people to try to go cheap. It really makes, because I feel like then you might have to spend more money to either fix what was wrong. It just, so some of those, give me a little hesitation, but I think, the way that, I've seen like talks parties and things like that. And I guess, it really depends on who's running the show, right?
Yes. Yes.
Okay.
We do see patients who come in because either they were at a party, or they were a model for a training, and something went not maybe in the best direction for them.
Yeah.
And you're right, then they're having to invest more time and energy in, fixing things. The thing with Botox is it lasts 3 to 4 months. So if you have a great treatment, that's wonderful. You look and feel good. But if something happens and somebody's not skilled, you could literally look awful for 4 months.
Mhm. Yeah.
And that we can't fix. It just has to wear off. So I think putting your money in things that are really important, and then save on other things. Um,
Yeah. No, and I saw another statistic that said that Botox for people between 20 and 29 rose 71% from
Mhm.
2019 to 2022. So is that something you do think is worth starting early, or do you think that that's just kind of, I remember having a very beautiful younger, like, I'm 43 years old. I think my hairdresser was like 29 or 30, and she talked about Botox, and I was kind of like, I wonder, does she need it, or is that something that is preventative and worth it for somebody at that point? Or when do you think people should start to consider things like the injectables versus just the facials and the skincare?
I think in your 20s coming in really and focusing on healthy skin
Mhm,
and, facials and peels, maybe a laser treatment. I think that's reasonable.
mhm.
I do see some younger patients coming in for Botox. If I think that they're starting to get a little bit of a static line, like a line at rest, or they're very, um, animated, etc., then we'll do just more of a kind of early intervention Botox treatment for them, like just to pump the brakes a little bit. I'm not a huge proponent that people should start Botox in their 20s.
Mhm,
I think, 30s and 40s is a great time. 30s is ideal.
mhm.
40s, you do start to get more changes. You've lost collagen, you get deeper lines, etc. So 30s is a great time to really start with injectables. And at that point, it's just really about a little bit of correction and maintenance.
Yeah,
Sometimes we have patients come in their 60s or 70s and they've never done anything. And, it's a big plan and we can get them feeling better, but we're not going to see the type of results that we are when someone comes in earlier.
yeah. No, I think that that's interesting because I think, yeah, there's sometimes where it's a trend. And then there's some people, like even some people who I had friends that started to go gray in college. It's just the way they are.
Right.
It's just kind of one of those things. So I think it's important. And that's good that you kind of do the consultations and figure out exactly what's right for that particular person instead of being like, yep, here you go. Because it is such a, it is something that you're right. You want to continue to do if you want to have the results kind of for make it worth it, I suppose, for something like that. I wanted to talk a little bit too in the med spa space. Another huge space that we're looking at as far as medical and technology in that space is the GLP-1s, the semaglutides. That is something that I have seen offered at med spas versus some people who are working with their doctor on that. Can
Yes.
you tell me a little bit about how in the med spa space, like how that, kind of works for you if you have clients that are coming in for that? What's the difference between getting a prescription? And I'm guessing that that's not required for you, but tell me a little bit more about that space and how that's just another area of your business that is, probably going to continue to get more and more popular.
Yes. Definitely things like semaglutide, tarzepatide, which the brand name is Monjaro, those injectable medications to help with weight loss are huge and they really can be life-changing for patients. So you are seeing more medical aesthetic practices offering those types of things as well as IV infusions, vitamins, peptides, things like that. So really venturing into that wellness space.
Mhm.
And I think in the future, we're going to see aesthetics really focused on beauty from the inside out. Start with the health of the inside and the health of the outside. In terms of weight loss, these medications, it's really hard for people to get them covered by their insurance
Mhm.
because most of the time you have to be a diabetic or pre-diabetic, or you have to have like a really high BMI. Um,
Right. It's not necessarily just approved for treating obesity right now, is it?
that's right.
Okay.
Yeah, most of the patients that are trying to get on these through their primary care provider and getting them covered through insurance, they're getting rejected,
Mhm.
or there's a shortage, you can't even get them even if you get approved because everyone seems to be on them. And then I've had patients who get approved and they go, let's say, to a local pharmacy, and out of pocket, it's like $1,400 a month.
Mhm.
And then they get it on a couple months, and then the pharmacy tells them they can't get it anymore. So there's a huge supply and demand issue as well as who's getting it covered. So medical aesthetic practices are getting it compounded through compounding pharmacies. We're getting the non-brand name.
Mhm.
And the nice thing about compounding it is it's the same components, but then they add a little bit. So they put like vitamin B6 in, which really reduces nausea, which can be one of the most common side effects of these medications.
Mhm.
And then you get it more affordable. So like in our practice, you do have to see a nurse practitioner. We have a whole weight loss program. They go over your medical history. We actually get your blood work done. We want to make sure that everything looks good. And we do collaborate with primary care providers, endocrinologists, whoever refers the patient. And then we'll start them on a 3-month plan. They come in every month for a check-in, and it's amazing to see the progress that people are making and how they just look and feel better with these injections.
Yeah, no, I've definitely seen like amazing changes for some people, some clients. But yeah, you're right about, getting it through I've known people who've been on it for 1 month and then the supply is gone. And I mean,
Right.
it's like, you're just starting to kind of get used to it. But you mentioned, yeah, the nausea, like there's certain things that are also a big part of it as well. But it's interesting to see. And do the people have to be referred to you or can they come in and talk to you directly?
Nope, they can make an appointment themselves, and we'll, get their lab work, go over their history. If there are any concerns that we have in terms of starting them on that, then we would reach out to their provider,
Mhm.
um, to make sure that it's a good plan for them. Um, and you do have to be overweight. I mean, that's the other thing. We'll have patients because it's a Hollywood trend as
Mhm.
well. So we'll have patients come in and they're like, I want to try that injection to lose weight. And they already are at a healthy, good weight. And those patients, we have to say,
No,
no.
that's good because I do feel like, yeah, it is tricky losing like the last 5 pounds or things like that. But this is medication. This is, it's certainly something. So that's good to know that that is an option for some people that are maybe struggling to, or are interested, but maybe don't fit the definition right now. I do think that that'll probably be changing. I think it's a very interesting area of the market to watch. Because you're right, this is changing people's lives and lifespan and health dramatic more so than I think anything we've seen in this space. So it's really interesting. I love how you're kind of committed to helping people live a healthier life. This is not just, to make everybody look 25. It is really to kind of improve their quality of life, their health. I think we've all seen how much confidence and, feeling comfortable in your own skin can help you in so many other ways that are not just, looking good in a picture. So I think it's wonderful. Tell the listeners who maybe are interested or maybe would love to visit one of your locations how they can find you and if they wanted to follow you on social media, how they could follow you as well to maybe start to get a little bit more education in their feeds
Yeah,
rather than
absolutely.
TikTok regime.
Yes. So we are, our website is rnesthetics with an E.com. We have 3 locations, Linfield, Newburyport, and Salem, Massachusetts. You can book, we make it easy. You can go on our website and schedule a consult with one of our providers. We even have online gift cards to make it easy for the spouses to get you a little something to get you started. On social media, we're on Instagram and TikTok, and we're RN_MA. We do try to do a lot of fun posts on Instagram and educational posts. We share a lot of treatments, try to make it so that people feel like they know our team when they're coming in the door and have an idea of what we do.
I think that's so important. It's so smart too, especially because this is, obviously, the same when I want people to feel like they get to know you a little bit before they come in because we're dealing with people who are dealing with personal issues, things like that. You want them to feel comfortable and well served and happy. So thank you so much for joining. And if you're trying to figure out if you have enough room in your budget to start to incorporate a better skincare routine or anything else that's going to improve your life, head over to mistylynch.com. I would love to set up some time with you to talk about that end of things. And thank you, Michelle, so much for joining us this week.
Thank you so much for having me. Can't wait to share.
Bye, Michelle.